When I was back in medical school in 2002, we were presented with a paper to read as medical students on health inequalities, and it made pretty harrowing reading. The fact that whether you were born into a postcode which was associated with socioeconomic deprivation, your chances of getting every single chronic disease that we know of was higher than if you were born into a wealthier family. And the really sad thing is that some 18 years later, health inequalities are even worse and are live and kicking across our county as much as anywhere else. So I think as a response to that in St Austell, we had a realization that a lot of our social prescribing was very much designed around the needs of older people. And what the COVID pandemic has highlighted to us, as Michael said, was that those health inequalities, and particularly amongst younger people, were even more prevalent. Young people have made a lot of sacrifices during this pandemic for older generations, educationally, and I dare say in terms of paying back the debt that's been incurred as well as numerous in numerous other areas. So we set about pulling together key stakeholders and providers of young people services across St Austell, got them together and described and worked through a way that we might co-design a social prescribing program that was bespoke for young people. Catherine's absolutely right. This is not about seeing those people in the surgery or medicalising this. And this is about moving and building assets and working together in our communities to help our young people, particularly those from disadvantaged backgrounds. The next step in that is to pull together a group of younger people and those key stakeholders, and for them actually to co-design what it is that they think will best meet their needs, what will help them have the aspirations that most of the people on this call would be used to, and the opportunities to achieve those goals, and of course to live in good health. What we see often in social prescribing is, and in these journeys is far too often across health and social care, is people putting the needs of their organisations ahead of those of communities and people. Too often we see duplication and even competitiveness rather than collaboration. I hope what I've just described in the way that we're designing our service towards young people is a culture of collaboration, of working together around what unites us all. And what unites us all is the desire to do the best for individuals and for communities. And building those relationships to break down organisational bias and working together takes time, but it can be achieved. And there's some fantastic examples of how organisations are mutually benefiting from working together across the county in social prescribing. So I think that's probably as much as I want to say, but now more than ever, I feel really strongly, and I'm sure that most of our colleagues will agree, that on health inequalities and on young people, we really must concentrate our efforts to work together for the good of our communities.